Hi, so what I'm going to show you is, and have a little look at, is actually rolling. It's an activity, obviously it's very functional, but it's also, because it's a functional activity, if sometimes you do little adjustments, you can actually make it as an exercise as well. So some people, what they'll do is they bend up their leg, they push off, and over they go, which is fine, not a problem. However, if you've got a problem with your leg and you can't push off, you could sometimes get stuck, so you may need to address that. So one of the things you could also, the other thing that people do is they might bend up the leg and then bring it up and over, and actually with that activity you're using your trunk. So they might bring one leg or even both legs up, then roll and lead with their head as well. Now that's certainly something that you need to consider, is what do people do with their head? Because what some people will do if they start to get stuck, if they've got some disability, is they actually get their head, they push with their arm and they push back with their head, and they're pushing back like that. Now, the problem with that is they're actually pushing back the direction that they want to go away from, and what happens is you can actually get stuck. You can get so far, and then as you can see, I'm stuck, and I've got to either use my leg or my arms or try and grab on something. So in actual fact, what you need to do is the head needs to actually lead, a bit like 100-metre final. You need to dip for the line. You dip your head for the line. So actually, if you lift your head up and then coming up and over like that, you'll come much easier. What will happen is your head comes up, your trunk then starts to work, and your body then has to follow. Okay? Now, it's sometimes what people can be taught if they actually have say they've got a paraplegic, they've lost use of their legs, or they just are unable to use them because of a neurological problem or anything at all like that. One way that you can actually look at for rolling is they can be taught like this, where they take their arms from one side and they throw them straight across the body. So throw them like that, okay? And if you keep using momentum, off you go. Now the issue with that is that when you're coming, your arms are coming back over, you're actually taking all your weight onto that side and then going that way. So a slightly more efficient way to do it is actually take both hands, and this is a bit like a bilateral PNF pattern that you may use if you're a therapist. But what you can do is actually just take both hands, so we'll take it from the far hip, I'm going to lift my head up, and I'm actually going to throw them up over my other shoulder, like so. So I'm going from there and throw them right over, and as you can see, my body wants to come quite easily, and in fact, if I keep reaching and reaching, I can actually flip all the way onto my tummy. So that is throwing in a diagonal. So what happens is, as I go over like that, if I have to take my arms back down, I'm not putting all my weight onto that side, so it's a lot more efficient. And what happens as I go like that is I elongate along this side, and so I've got a stable side to actually go onto. And then you can come back like so. Okay, thank you very much.